Hi, my name is Tony Fernandez, and I am ESO's Principal Research Scientist. The Trauma Index are a series of measures that ESO has come up with that are evidence-based. Agencies can use the 2024 Trauma Index data as a benchmark. If you can't measure it, you can't improve it. I think hospitals would want to compare their own results because it's hard to know how well you're doing for your patients if you're just looking at your own data. In 2024, the key performance indicators include an investigation of blood and blood products, the injury severity scores and how that relates to mortality, long bone fractures, and the administration of antibiotics for patients that do have a long bone fracture. We'll also look at penetrating trauma patients. And for penetrating trauma patients, we want to look at some factors that have to relate to their survival, hospital events, formerly known as hospital complications. There are two new metrics in this year's index. We're going to, for the first time, look at time to transfer, and we're also going to look at mechanisms of injury and do a deeper dive into the reasons for some trauma patients coming to trauma centers. I think real-world data is important because it takes out some of the guesswork. We can see what's working, we can see what's not working, and we don't have to rely on what folks believe will work. We can actually prove whether it will or not. Make sure you download the 2024 Trauma Index so you can see how your patient care stacks up to the national average.